Hello everyone, my name is Dr. Arvind. I'm a consultant spine surgeon working in Mumbai and Navi Mumbai. Today we'll be discussing some cases of spine osteoporotic fracture. Now, case 1 is an 81-year-old female which had a fall at home about 2 months back. She was a Tamil speaking lady exclusively, so that was a language barrier for me. In terms of complaint, she had pain in her back, especially while turning in the bed and while getting up from the bed. She had increased pain since 2 weeks and she was not able to mobilize because of the pain. On examination, she had tenderness in the dorsal-lumbar region. The skin overlying was normal, the neurology was normal, and there was no radicular pain. In terms of investigation, we did this X-ray in which you can see that the D11 is fractured. We measured the height of the collapse and it was about 50% of collapse, and this was an AP X-ray for this patient. Additionally, we did an MRI in which we could see that there is increased bone edema at this D11 region, showing an inferior end plate fracture with no compression on the dural sac. So for on an coronal image also you can see that there is this fracture with increased signal. So for this patient we did an vertebroplasty. So how I do a vertebroplasty is, this is going to be my incision on an X-ray in which these are the pedicles, these are the spinous process, and these are the transverse process, this is the spinous process. So my Jamshidi needle starts on X-ray over here on the lateral end of the lateral side of the pedicle, and slowly and steadily I tap it to the medial end of the pedicle circle. On lateral X-ray in the same time, I should see that my Jamshidi needle has reached across the pedicle and reached into the vertebral body. Similarly, I put two Jamshidi needles and then we do a vertebroplasty. This is the level in which it has crossed the pedicle over here and it has reached the medial border of the pedicle on AP. Then slowly and steadily with 1 ml syringes, I put in a cement of about 5 to 6 milli ml, and we put some small sutures with ethylone to wrap up the things. Now there are a few points to ponder in vertebroplasty. First is, in vertebroplasty the pain relief is only seen in acute fractures based on this meta-analysis. In vertebroplasty, if you additionally put facet joint injections, it is better based on this randomized control trial. The chances or the risk of adjacent fractures after vertebroplasty is about 18% based on this paper. And lastly, if you compare vertebroplasty with kyphoplasty, there is no clear winner in terms of the outcome. However, the cost of kyphoplasty is more. Now, case 2, this is an patient who was a 70-year-old male, chronic renal failure patient on dialysis, which needed to be done every 3 days. He had pain in the back since 2 months and decreased mobility. He had direct tenderness on the dorsal lumbar region. Neurology was normal. He was not able to sit for long to eat. In terms of his investigations, he was anemic and his platelets were really low, 1.43 lakhs. Creatinine was high, urea was high, 267. His parathyroid hormone levels were really high, 85, and his vitamin D was low. This is a classical features of chronic renal failure, which affects the bones, the blood, and the heart. So in terms of consideration for the surgery, he was unfit for anesthesia and was very high risk. So we did him under local anesthesia. I didn't give any sedation also to this patient, but I do prefer to have an anesthetist looking after the patient when I'm doing the vertebroplasty. Okay, so this was the vertebroplasty done for this patient. The patient had good pain relief post-operatively. Now comes the case 3. This patient is an 84-year-old female who has got a spinal fracture of displaced type 2 odontoid. So this is at the body and it is a type 2 odontoid fracture. So she had a fall in the garden and later on she had some occipital headaches. That's why she had come to us. In past medical history, the patient has got myeloma, hypertension, type 2 diabetes, and anemia. In terms of medications, she is on apixaban and is currently undergoing the third cycle of chemotherapy. So all in all, 84-year-old female with a known case of myeloma. We were not thinking of going really aggressive in this patient. She had some power reduced in her C5 and C6 region on the left side, but there were no upper motor neuron signs. So we had keep her on Aspen collar, which is kind of an hard cervical collar with occipital extension with precautions, and we did an CT and MRI for her. So this was a CT scan which shows that there is no other fracture as such except this odontoid fracture. We also had these cuts in which we can see that there is no facet fracture. On MRI, we can see there is no major cord compression at that C2 region. However, there is some disc over here, but that might be explaining some weakness. But all in all, majorly, she didn't have any major cord compromise. That's why we managed her conservatively with an Aspen collar with occipital extension, which didn't show any major uh, displacement of the fragment on an Aspen collar, and that's how we manage them conservatively. Lastly, we have this 52-year-old female who is a known case of epilepsy. She had fall after seizures and she had pain in the hip and the groin and was struggling to mobilize. 2 years back, she had an osteoporotic fracture which was managed conservatively. Here you can see on an MRI that osteoporotic fracture. In past medical history, she is a known case of rectal cancer with permanent stoma and she has got alcoholic liver cirrhosis. So the MRI also showed that she has got bilateral sacral ala fractures, which actually can explain her pain in her groin and hip region. So we did an vertebroplasty, a cement augmentation for this patient. So on this side we have put cement in S1 and S2, and here we have put cement on S1 region, and on an inlet view here you can see that our area of the dural sac remains uh, unbreached, and on lateral we can see this is the x-ray. Thanks for patient hearing. Thank you. If you have any questions, do let us know. Thank you.